There's no doubt that one of the biggest barriers to pharmacists' ability to focus more on delivering clinical services to patients is time. Effectively integrating pharmacy technicians into the workflow of your community pharmacy could make a significant difference. Since 2010, the Ontario College of Pharmacists has been registering pharmacy technicians. Today, there are more than 3,000 working in community and hospital pharmacies throughout the province. These highly trained professionals have successfully completed an accredited education program or bridging program, the college's practical evaluation program, and passed the Pharmacy Examining Board of Canada qualifying exam and jurisprudence exam prior to being registered with the college. As regulated healthcare professionals, the college holds pharmacy technicians responsible and accountable for their scope of practice, relating to the technical aspects of product preparation for refill and new prescriptions. Consider this prescription. A pharmacy technician can independently complete the technical aspects of filling this prescription, including not only the product preparation, but also the final check, and ensures that the container has the correct medication, that is, drug, dose, and regimen, as per the prescription. However, only a pharmacist can ensure that this medication is appropriate for the patient and provide counseling. These essential cognitive functions are outside of the scope of practice of a pharmacy technician. To demonstrate the benefits of integrating a pharmacy technician into your community practice, consider a generic workflow with 5 basic tasks and a staff of assistants, that is, non-regulated personnel, pharmacy technicians, and pharmacists. The generic steps include input a prescription, prepare a prescription, final check of product preparation, check of clinical appropriateness, and patient consultation. Assistants, pharmacy technicians, and pharmacists can input and prepare a prescription. Pharmacy technicians and pharmacists can perform the final check of the product preparation. Only pharmacists can assess the clinical appropriateness of the medication and counsel the patient. A pharmacy technician not working to their full scope might look like this. An assistant inputs the prescription, with a pharmacy technician handling the product preparation, with the pharmacist doing the final check of product preparation, ensuring clinical appropriateness of the medication and ultimately counseling the patient. Often in this type of scenario, a pharmacist combines the final check of the product preparation and assessment of clinical appropriateness. But let's take a look at what can happen when these functions are separated and a pharmacy technician, working to their full scope, is integrated into the workflow. An assistant could still be utilized to input a prescription, with the pharmacist available to conduct their assessment and determine clinical appropriateness of the medication up front. The product could then be prepared by an assistant, with a pharmacy technician performing the final check of the product, leaving the pharmacist to counsel the patient. Of course, this isn't the only way to adjust workflow. At the beginning of the process, the pharmacist, in addition to assessing the appropriateness, could provide counseling, leaving the prescription to be prepared by an assistant, checked by the pharmacy technician, and then released to the patient. The end result is always more time for pharmacists to shift their focus from dispensing of medications to the delivery of clinical services. For more information on the integration of pharmacy technicians, check out the practice tool Pharmacy Technicians on the college website.